We are the top leading organization who really sets out the advocacy agenda to come against the tobacco industry in the U.S. So the Tobacco Free Kids organization has been around for 25 years now. We're celebrating that 25th year anniversary. We've done that by really focusing on that next generation to end smoking there. So we're focused on kids. We are committed to confronting the tobacco industry's preying on communities that have been marginalized. Specifically within the African American community, we are building a coalition of members who will help us to engage, to educate, and to actually spread the word within their communities on this devastating product.
Good evening, good evening, good evening. My name is John Burns, and I'm one of the managing partners at the Burns Brothers. And I'm so humbled and honored to serve as moderator for today's conversation. And just to give you some insight prior to jumping right into the conversation, this is part of the Campaign for Tobacco-Free Kids, Campaign for the Culture, which incorporates a number of different things. In addition to this cultural conversation, it incorporates an HBCU listening tour, advocate profiles, amongst many other things. And this is actually the second conversation in a series of conversations hosted and spearheaded by the Campaign for the Culture. And the leading force behind this Campaign for the Culture is here with us to really dig deep into this kind of starting the conversation. Ms. Portia Reddick-White. Portia is the VP of Strategic Partnerships for the Campaign for Tobacco-Free Kids. Good evening, Portia.
Good evening, John. Glad to be here.
Well, Portia, first of all, thank you for the work you're doing, the work of the organization, and really moving the needle around these very important issues that we all care about. And so I kind of want to jump into something that made headlines a few weeks ago, and that was the CDC announcing and declaring that racism was a threat to public health. Talk to me about what do you think about the timing of such a declaration?
Well, the timing of this it's awesome. It comes with the convergence really of what's been happening in the country and the nation and the world with COVID-19, that pandemic. And finally, America is reckoning with the race issues that we have. And we owe credit to so many of the organizations who have been creating this social pressure, drawing attention to the inequities and injustices that the African American Black community has faced and really continues to face right now. So we welcome the statement. We think it's about time. They're absolutely right. We've got to build a healthier America for all. And in order to do that, we've got to confront the systems and policies that have resulted in this generational injustice that has given rise to racial and ethnic health inequities.
Portia, I couldn't agree with you more. And you hit the nail on the head. And I want to dig deeper into a concept you just mentioned around policy. So what policies, as a result of this really far-reaching declaration that we all agree was very, very timely and very important, what policies are important that you believe that really need to get moved forward around some of the issues that really face and really implicate minority communities around health inequities and disparities?
Well, actually, we are right in the midst of a policy discussion, a policy emergence, hopefully tomorrow. April 29th is a deadline actually for the FDA to make a decision on whether they are going to start any kind of process that will ban the menthol cigarettes and menthol products that have just really been placed within the shelves, on the shelves by the tobacco industry. They've made a lot of money off of placing these products. And frankly, 85% of African-American smokers, this is the product that they use, menthol cigarettes. And we're very concerned because, as you probably know, and others who are joining tonight, that tobacco is the number one preventable cause of death among African Americans. and African Americans are disproportionately impacted by tobacco use, and they die at higher rates than other groups from tobacco-related diseases like cancer, heart disease, and stroke. And lung cancer actually is the leading cause of cancer deaths in the Black community. And let me tell you what this thing is about menthol. Menthol is something that, when added, makes the cigarette or the product, because it's not just cigarettes that are combustible, but it's also the non-combustible products. It makes it go down smoother. So it doesn't irritate your throat as much. So it goes down easier. It's easier to get hooked on it. So you become addicted to it. It's hard to get off of it. And the result is that people get hooked and people get these morbidities and they die. And we don't want that to continue. So that is a policy that we are definitely stand behind and pushing. Years ago, they took off other products that had flavorings, but they didn't take off menthol. Since 2009, the FDA has had the ability to do that. And we're hearing that that's a possibility that can happen as early as tomorrow, that they will start the process, hopefully. We hope that that's what happens.
No, wonderful, wonderful, Portia. And thank you for sharing that, because I think it's really important for everyone who's listening and tuning in to really understand the kind of the historical perspective that you provided. And then also, what are the next steps and what's a potential timeline? So we know there's a big potential ruling tomorrow around this April 29th decision from the FDA, but what does it look like from a timeline perspective? If it's possible to ultimately ban menthol, what would that timeline look like?
Well, look, it can take a very long time for the FDA to really move forward on this type of thing. Frankly, they have the possibility of never issuing a final rule. We hope that doesn't happen. The agency can be really committed, and we hope that they are, and that they would be required by law then to make sure that any comments that would come in on this, that they would respond to. Frankly, they've got like at least a 60-day period. If they were to say, hey, we're going to open up this rulemaking process, they've got at least 60 days that they will say that they will accept comments. And within those 60 days or more, because it could be more, they've got to make sure that they then go through those comments. And after they go through those comments, that could take a bit too. Then after that, they might decide to go ahead and issue a final rule. And if they were to do a final rule, by the way, it could be hundreds of pages long. They could possibly then issuing that final rule would trigger, more than likely, the opposition to maybe even file lawsuits. We're talking about probably years, really, months, years of anything really coming from this. But this is the first step. And this is the step that is really important, that everybody understands and everybody supports. It's the first step in saving lives from these tobacco-related diseases. And there are many, 45,000 lives a year. That means something.
That means everything, Portia. And I think you said something so brilliant. This is the first step, and everything and every action takes a first step, and that's this. And I think it's so instrumental and critical that we all take this first step, and we all are very supportive. So what can we all do who might not necessarily be in the tobacco control space, but we're common citizens who care about the lives that could be saved? What can we do to support all the incredible work that you're doing?
Well, first of all, I have to thank all of you for joining the conversation tonight. That's number one. Second of all, I would ask that you reach in to us. We've got a website, and we've got ways that you can do that. Reach into us and ask for support within your community. We've got groups that we are working with. We have partners that we're working with, some of which will be on tonight. If you're a young person, join and become an ambassador with us to help spread the word and engage your community and share among your community how, this means the world to you and saving those lives of youth to come. And if you're belonging to a sorority or fraternity, reach into them. Let them know that this is important to you. If you belong to the NAACP, reach into them. Let them know this is important. We'll all connect. We are all connecting. So reach in, and we will support just moving forward with you to help save lives with us.
Excellent, Portia. No, and I think that's so spot on. And so I just want to make sure everyone knows the great service of the organization, 25 years of service, saving lives across the country. Talk to us about some of the initiatives, some of the things that the campaign's really pushing out beyond this 25 years to really kind of continue to save lives. And I know you mentioned us being supportive. What can we do and what kind of initiatives can we really rally behind?
So this is our 25th anniversary. Thank you for mentioning that. And we do we address big tobacco every year with some kind of huge effort. Frankly, that effort happened earlier this month, and we call it Take Down Tobacco. Actually, if you go to our website and look at Take Down Tobacco, there are trainings there that you can help and take to learn more a bit about advocacy and what we're doing. Within each and every state, we have the availability to be active, to help carry out some of these policy campaigns that we have. But we are raising the bar. We're reaching out right now to have more youth join us as a youth advocate. I mentioned the big roast of big tobacco that we had earlier this month. It was actually April Fool's Day. We're starting other initiatives. You actually mentioned the HBCU listening tour. I think that we have started to go around the country. We're going to be doing more of that. We have an HBCU roundtable. We want to continue to right now do a laser focus on communities of color specifically that have been targeted, and not just communities of color, but also the LGBT community and the mental health community. These folks, all of them have been really targeted by big tobacco, and we want to reach out to them. And I would be remiss if I did not mention that even globally, we have a global side of our organization that reaches out nationwide, really just elevating some of the critical needs, healthcare, transportation needs that people have to help them to have longer lives, including fighting tobacco in that area as well.
Well, wonderful, Portia. Thank you. Thank the organization for all the incredible work that you're doing, 25 years of service and continuing to save lives every day. Thank you, thank you, thank you. And I look forward to, and we all look forward to hearing from you later. So at this time, I want to transition into our first conversation with some really, really, really dynamic experts, supporters, ambassadors in the tobacco control movement. And at this juncture, I would like to welcome to the stage Delmonte Jefferson, Executive Director, the Center for Black Health and Equity, Ms. Tatasha Phelps, Lead Senior Staff Attorney, Public Health Law Center, Commercial Tobacco Control, and Miss Alyssa Williams, 2020 Barry Fisk National Youth Advocate of the Year Award recipient, Tobacco-Free Kids Ambassador, and a freshman at Howard University. Good evening, good evening.
Hello.
Thank you all so much for joining us. I really, really appreciate it. And really want to just kind of get into this conversation. And what we're really focused on is addressing and talking about some of the health disparities, right? Facing communities of color around some of this tobacco use and some of the tobacco control issues that we really, really care about. And Delmonte, I want to throw my first question out to you. When you think about the work that we all care so much about in the tobacco control movement, whether it be tobacco taxes resulting in higher prices or age restrictions or banning all flavors, talk to me about what you feel, whether it be a collection of everything, or what do you feel really works best in really making an impact on the industry?
Well, that's a good question, John, and I appreciate you for asking that question. And the answer, really from my point of view is simple: banning the sale of mentholated tobacco products. Now, from that standpoint, this announcement that's going to come out from the FDA tomorrow, this is historic in nature and its proportion. I mean, the banning of mentholated tobacco products or addressing menthol, period. This isn't something that we just started doing back in 2009 when the FDA left it out of the Tobacco Control Act. This was going on back in 1990 when the tobacco industry came into our communities in Philadelphia with Uptown cigarettes and tried to bring that menthol product to our communities. It was packaged nicely. It had the green colors on it. And they said, this is something that Black smokers would like. Well, Sharon Sutton and Reverend Jesse Brown and Bob Robinson, these folks, they rejected it. They even got Lewis Sullivan with them to send a letter to the tobacco industry and said, no, you can't just come and marketing these products to our communities. So that was the first time, and I'm talking in 1990, 31 years ago, that the industry tried to target us with flavors, and our communities said no. Now, then you fast forward to 2009, and as Portia talked about, they excluded menthol from the legislation. And we, again, our organization said, well, how in the world can you do this? How can you leave menthol in when you know the devastating effect, when you know the predatory marketing tactics that they've done on Black folks? And so we were petitioning, we were asking the FDA to do something. The FDA did nothing. So then we went to local efforts. We started doing local campaigns, and we work with the Public Health Law Center. And you're going to hear from Natasha in just a minute. We work with the Public Health Law Center to start putting out local sales restrictions, banning the sale of menthol. Chicago was first, but these other states followed. Now, we still kept trying to get the FDA to do something, and they did nothing. So, Portia was kind of nice and easy on them, but I think clearly that tomorrow's historic decision, that is a day of celebration, and I'm going to celebrate like it's Juneteenth up in this piece, because what they're doing tomorrow is something that we've been fighting for 31 years.
Del Monte, I think we all are going to celebrate like it's Juneteenth. I think that was a great, eloquent way of really putting it, providing the historical perspective that I think is really, really important to frame this issue. Natasha, I want to go to you next and really talk about, Del Monte really framed it, but really talk to us what's at stake. I know Portia really kind of delved deep into it, but I know your expertise and your background can really even bring this out some more. So kind of elaborate on, what will happen and kind of your own expertise around this as well.
Sure. Well, as Portia mentioned earlier, today, this is about advancing equity in general. It's not just about health equity, which is very much about health equity, but health equity is equity. Public health is advancing health equity. It's all the same thing. And so when we have had menthol on the market, and the industry has used that because of its addictive nature, because of its cooling sensation, all of these things, they have always targeted the Black community for decades and decades. They have always done this. In their own tobacco industry documents, they have identified young Black people, specifically in some of their documents, young Black men, as the trendsetters of our culture. And so they targeted them, did really in-depth research to figure out how can we appropriate Black culture so that menthol flavored cigarettes becomes a part of that culture, so that we have a long-term stable revenue that turns into profits in our pockets. What that has done is taken advantage of systemic racism. So for example, the tobacco industry has really taken advantage of the fact that our politicians, our organizations, our publications have been limited compared to, other politicians. They're white politicians or white-led magazines, for example. And they've said, there is oppression, there is under-resourced situation here. Let's put our money here, and so we can permeate and really have a stable stream of profit coming out of this community. And the tobacco industry has really taken advantage of all of the economic, environmental, and social conditions that create this really difficult systemic oppression that the Black community faces. So it's not just that they have seen it and taken advantage of it, they've made it worse because Black people for a long time have been dying because of commercial tobacco related illness, death, and disease. It contributes to the top 3 causes of death for African Americans, are exacerbated by commercial tobacco use, especially during COVID. We know that COVID exacerbates COVID symptoms. It increases your likelihood of death and severity. And so the fact of the matter is the tobacco industry has seen systemic oppression for what it is and not addressed it in a way that's helpful, but actually made it worse because they know that it helped them line their pockets. And with them doing that, they have really, I think they are one of the original major industries of the modern era that has figured out how to make profit off of systemic oppression. And so other industries have followed suit. We see the type of talking points that the tobacco industry puts out there in gas and oil, minimum wage fight, environmental justice. We're seeing these same talking points that the tobacco industry developed to try to take advantage of systemic oppression. And so by us saying, menthol is something that we're no longer going to see on the market, that can have a domino effect that we maybe aren't even aware of. We're showing that a major industry can't take advantage of an already oppressed community. And this will improve the lives of Black people. It will improve Black health. And that means it will improve overall public health.
Natasha, wow, I've done with Alyssa. Thank you. And you hit a couple key points. I mean, the talking points of big tobacco, I think, is critical to really understand the generational marketing and the messaging tactics. And I think that's really all very, very important to kind of frame this larger, bigger picture issue. And so, Alyssa, I want to go to you. Being a youth ambassador, being so compelled to get involved in this movement, and kind of hearing what Natasha's talking about, hearing from Portia and Del Monte, you as a youth on the ground, while we can talk about raising the prices of cigarettes or doing different things, what can we do to prevent youth from ever picking up tobacco, in your opinion?
That's a really good question. There's so many things that we can do, but I think the main thing is really giving the youth those resources. Black people have always been at a disadvantage when it comes to getting resources, and not only in their communities, but in schools, in their homes. So really, taking the extra step, the extra mile, and putting those resources out where they can reach, where they're so easily, they can retain it, like things like the campaigns, programs and stuff like that, where you can just do it at home, get those resources, learn from, the comfort of your home, have ambassadors that you can speak to that share the same experiences as you in the same communities that you grew up in. Things like those, I think that's the biggest thing, is with these resources, they can really educate themselves, give themselves that opportunity, that advantage to make, the best decisions for themselves and, their health moving forward.
Alyssa, couldn't agree more. And I think resources. And Natasha, I want to go to you on this. So if the FDA decision goes through, menthol gets banned, there's still going to be a systemic racism problem in this country that's still going to need some support, or people of color are going to still need support, whether it be cessation support or whatever. What do you think needs to happen from a support standpoint to still be there for our people and support our communities?
Yeah, thank you, John. That's a great question. Like what Del Monte has said, exempting menthol has always been a mistake. And, I'm really grateful to our I call them heroes because they're heroes of mine, commercial tobacco folks who have been leading this cause. And Del Monte's being, humble, but he's definitely been someone who I've looked up to doing this work for a long time, as well as Dr. Phil Gardner, Dr. Valerie Yerger, Carol Magruder, and some of the others that Del Monte mentioned. And the whole time it's been about, we need to get menthol off the market, but it has always also been about, we need to support our communities. And this message has always been about coming from a place of love. And when you do that, when you're working on that, that does mean being aware of why people are using these products to begin with, right? So yes, we have the tobacco industry heavily marketing. Yes, we have this permeation into the Black community, but then we also have these social determinants of health, these social, economic, and environmental factors that really do increase your likelihood of using commercial tobacco products so much. So if you're stressed because of systemic racism, if you're stressed because you're working a minimum wage job, or maybe you don't have a job, maybe you're also suffering from other substance use disorder, these are all reasons why you would be pushed to addictive products like commercial tobacco, and why it might be difficult for you to quit. And so while all these folks have been working on getting menthol out for a long time, they've also been talking about the need for culturally competent, accessible cessation services and products for African Americans who are interested in quitting, or who would quit if menthol was removed from the market, which studies have shown would be the case. And Alyssa, I'm so glad that you said that. I mean, I'm just beaming just looking at you, because young people working on this are really the voice of all of this, because it's not just about taking them off the market. It is about supporting people who are coming off of this addiction and helping them, because this is an addiction. And so it's not just culturally appropriate cessation resources and getting things off the market. It's also working as public health advocates to reduce and eventually eliminate systemic racism. And that's a big task. But there are communities across the country who are working on racism as a public health emergency. Public health law center is working on this too, to ensure that we're alleviating these problems. So yes, we take menthol off the market. We have culturally competent, accessible cessation, which is something that a lot of African Americans struggle with accessing because it's not culturally competent. They don't have insurance, many different reasons why they might not have that. But then we need to continue as public health folk to work on this issue, because it's not just going to go away, like you said, John.
Well, Natasha, yeah, no, I completely agree. And again, the culturally competent type of resources, that's instrumental. That's critical. And I couldn't agree with you more. And Alyssa, I want to jump back to you and then to you, Del Monte. When we think about just the education piece around your age group and the folks and the youth that you work with, do young people really know the, I guess, health consequences of e-cigarettes? Do they think that they're worse or better than smoking traditional cigarettes? Talk to us about the mind frame of young people around the health consequences of these of tobacco.
Definitely another great question. I know for sure that, when I was in high school, which wasn't that long ago, only a year ago, but that's when these devices, when they came out, we didn't really know anything about them. And to us, they were marketed as like a social activity. It was just something cool to do with your friends. We didn't really know much about them. And what we did know is, from big brands like Juul and things like that, that they were supposed to be cessation devices, going back to that whole, they're supposed to help us, that's all we really knew about them. So I think now moving forward, the youth are definitely getting more educated, more engaged on, what these products really are. But there's still some blurred lines on, is it really healthy? And I don't think majority of people my age, we're still so unclear with these things, because we'll have information come out, but it's, again, who's getting those resources? It's not the people in my community. It's not our age group, So we're still kind of stuck in a whole, we don't know what's going on. But, we're trying our best to, educate our peers and let them know, like, this is not a cessation device. It's kind of getting on the same line of being just as bad, if not worse, than, standard tobacco. And it's definitely not a product that we should be using socially. And this was mentioned in our HBCU tour with Howard University, that there's, because of all the information and knowledge that we do have now about standard tobacco, it's become like such a taboo, like, oh my gosh, do not smoke. Like, that's so disgusting. It's embarrassing, but it's cool to, pick up a hookah or to do an e-cigarette or have any of those devices, because it's like, who's going to stop us? Nobody knows what's going on. We don't really know what these products are going to do to us 10 years from now. So it's just kind of like, we need to stop the blurred lines and, get that clear messaging out there, get those resources out there so the youth really know, like, don't do this.
Yep, absolutely. And Del Monte, I think Alyssa said some incredibly powerful and poignant statements. And she talked about a couple of different things. She talked about messaging. She talked about resources. But she also talked about community agents being leaders for change. And I'm kind of paraphrasing what you said, but I think, Alyssa, that was a big thing. And Del Monte, Natasha mentioned you have been a great leader in this space for so long. How can we mobilize other community leaders to really stand up against big tobacco?
Well, that's a great question. What we have here and what we're witnessing even at this moment, and we've got to really appreciate the significance of this moment. I mean, last week we saw the George Floyd murder trial end up with a guilty verdict for the officer that murdered him. Now that was historic in its nature. I mean, we don't often get victories like that where the police and law enforcement is held accountable for its actions. And then tomorrow, we're going to see the FDA issue this historic ruling banning the sale of mentholated tobacco products, again, saying that the tobacco industry will be held accountable for its actions, for its predatory marketing of these tobacco products. And so as we start seeing systems being held accountable for systemic racism. That's how we start addressing systemic racism. I mean, quite frankly, it can't survive unless there's a level of accountability. Someone has to be held accountable. And so what we're seeing is now leaders are saying to themselves, civic leaders, our young people are saying, wait a minute, systems can be held accountable for injustices. It can happen. If police officers commit murder, they can be held accountable. If the tobacco industry unfairly and unjustly targets Black communities, they can be held accountable. Now, mind you, yes, it might take some time. I mean, this is a long fight that's been going on. And as Natasha said, you know, Dr. Yerger, when she first heard about this and got involved, and Dr. Gardner and Carol Magruder, when they started this work with the AATCLC to get involved, it's taken some time, but still they've shown that persistence and being on the right side of justice, systems can be held accountable. And this is what we want our young people to see and our young people to respond to. You can hold these systems accountable for injustice.
Natasha, I see you shaking your head. Any additional thoughts there?
I mean, yeah, I just love listening to Damani go on about this, because I feel it. I feel his passion. And I think that's the thing. It ignites me a lot, because the industry fueled talking points that are, you know, some are circulating, and because you asked about, you know, other organizations, they're just so harmful and hurtful, because they're really taking advantage of these very real issues that we're facing as a community. You know, I mentioned George Floyd. I'm in Minneapolis. George Floyd was murdered just a couple of blocks away from where my parents live, where I grew up. And these are very real issues in all of our lives. And Black people know how serious this problem is. And so the tobacco industry is really taking advantage of all these other, like I said, systemic racism and oppression, by saying that things like flavor bans on a federal, state, or local level will, you know, do all these things, will increase police interaction and lead to mass incarceration. They're appropriating all of these very real issues in a way that's absolutely false. If anybody on the call right now wants to talk to me about any of these issues, I can debunk all of their talking points, because they're wrong. You know, these types of regulations are meant to regulate the industry and the industry alone. And we really need to protect our community, and that's our main focus. And so I was just nodding, because it's like, I agree with Dalmani that the more we see acknowledgement by our federal government, by our state government, by our local government, that our lives matter, that, you know, industries cannot get away with trying to appropriate these very real issues in order to gain profit. That message is really, really good for all of us, and especially young people who are going to shape this world in a way that's healthy for everyone. So yeah, I'm really happy to hear it.
And speaking of young people shaping the world, Alyssa, I want to transition back to you. And I'd be remiss about having a conversation around health inequities and health disparities without talking about a very real problem about mental health. In your space, and the young people that you work with, and kind of your peers, are they aware of some of the kind of the racial disparities and the implication on healthcare in our communities? And then also, how does that affect that you've seen from a mental health perspective, the implications that you've seen from these racial disparities cause?
Right. Apologies. This topic always gets me a little emotional, because, you know, Black lives do matter. And in a situation, in issues like this, especially tobacco related, it just kind of always blows my mind just hearing people be as passionate as I am about how like crazy it is, how we're targeted in every little thing, to like the smallest products in our convenience stores. So one thing I can say though is my generation is not playing around. Gen Z definitely cares and is definitely on top of things. And we definitely recognize those racial related disparities, especially mental health. Personally, you know, sometimes these things get to me. And again, it goes back to those, you know, Black people have always been at a disadvantage when it comes to getting these resources to help us get through things, especially when, you know, we're out here facing the most discrimination and oppression as is, especially when it comes to even when it comes to tobacco. And especially as a youth, you know, in high school, mental health was something I struggled with, you know, not only being an activist and carrying so much knowledge, but not knowing really what to do with it, because it's like, I recognize, you know, economically I could be at an advantage than some of my classmates, and I'm getting these resources because, you know, they're put out there more for me, you know. And it's crazy because it's just crazy. We're living in a crazy world, but I'm feeling very optimistic lately. And, you know, things are definitely getting better, especially with the recent trial that just went on. And hopefully tomorrow, you know, this ban on menthol is really going to be a great step forward for us. And I think it's very important to address that tobacco plays a big role in the mental health you know, aspect, especially in our young people. You know, these devices are marketed towards us as, you know, a way to be stress free and stuff. And if anything, it's just adding to it. So I think it's a very important topic to talk about when it comes to mental health, especially in its correlation to tobacco control.
No, thank you. Thank you, Alyssa. And just one final question. I just want to jump till Demonte, and then we're going to switch over to our next panel of speakers. But Demonte, Alyssa really spoke to the mental health implications. What do you say to individuals who use tobacco for that very reason, to kind of deal with, you know, mental health reasons? How do we prevent them from using tobacco?
You address systemic racism. You address the health inequities, social, economic, all that exists within our communities. Once you start addressing those stressors that might lead people to smoking, once you put a focus on why people are smoking in the first place. I mean, if you're living in a neighborhood, you're living in a community, and you can't go outside to get the exercise you need, not because there's no parks there, because you're afraid of getting shot, you're afraid of getting robbed, or it's, you know, you've got other reasons that you don't want to go outside, or you've got to go to work. You know, COVID is out there and everybody is, you know, a lot of folks are dying from COVID, you know, and a lot of folks are then safe, and a lot of folks don't have to go to work and they get to work from home. But you got to go out and work, and you got to go out and serve these folks either at a restaurant or in a grocery store. That's stressful. So you've got to put your life at risk to serve someone else. All these stress factors that you're dealing with, it's no reason that we can't see why calls to the quit line have decreased sharply since COVID. Folks don't want to call the quit line and deal with quitting tobacco because they've got other pressing issues to deal with. So if we start addressing these social and political determinants of health, if we start addressing where people live, where they work, where they play, their health care, and how they have access to it, we start addressing those concerns, and the need to smoke goes away. At least that stressor that our communities feel from systemic racism, from economic oppression, from social injustices, it goes away. I mean, I just got to say, you know, Natasha was talking about, you know, the whole arguments that some institutions or some organizations, Black organizations, are putting out about this whole criminalization and don't ban menthol because it's going to lead to more interactions with police. Well, you know, we've just had 2 Black people killed in the past 2 weeks, you know, that had nothing to do with cigarettes, but they were killed because of social injustices, because of systemic racism, and there being no accountability. And so, you know, we can throw that argument, as Natasha said, out the window. Black people are going to be killed by law enforcement because law enforcement wants to kill Black people. That's why that's going to happen. They want to intimidate them, want to keep them down, keep them oppressed. And so you deal with these systems, you deal with this oppression, you deal with these injustices, and you deal with the mental health stressors that cause people to smoke.
Incredible conversation. Can't thank you all enough. Demonte Jefferson, Natasha Phelps, Alyssa Williams, thank you.
Thank you.
Thank you.
Thank you, John.
At this point, you know, I would like to transition into our next panel discussion. I think that was incredibly powerful conversation, and this next panel will be equally as compelling and equally powerful. So at this juncture, I would like to introduce Dr. Tricia Hilliard, pediatrician, Little Spurs Pediatric Urgent Care, Miss Beverly Watts Davis, Chief Officer of Resource Development and Program Support and Senior Vice President, Texas West Care Foundation, Bryce Moore, 2016 National Youth Advocate of the Year Award recipient for the Tobacco Free Kids and ambassador as well. And then Ify Chidi, Vice President, Bay Area High School Youth Prevention Club, Tobacco Free Kids Ambassador as well. Good evening, good evening, good evening.
Good evening.
Well, thank you all. And I
Good
know you
evening.
all were, good evening, good to see you, Bryce. I know you all were listening in to that just incredibly powerful conversation that we just heard from the group before you all. And I think I was moved by a number of different things. Obviously, Alyssa's point about resources being available, and then the systemic racism and everything that we as people of color have to deal with, and then tobacco control issues and tobacco use issues that come as a result of that. Beverly, I want to take go to you for my first question.
Okay.
And think about just tobacco use. Would you consider tobacco use to be substance abuse?
Oh, absolutely. And let me share with you, tobacco use is a leading preventable, and I want to repeat and emphasize, preventable cause of both morbidity and death in the United States. So 80 to 90% of adult smokers actually began smoking when they're adolescents, which tells you not only how that it is addictive, but how long it is addictive. Even when you look at all of them, and I've been in this field for close to 30-something years, when you look at addiction cycles, if you're looking at people who have been addicted over 30 and 40 years, that's not very likely. So daily smokers most of the time started before they were 19 years of age. And actually, you all, if we really think about this, this should be viewed, Dr. Hilliard, as a pediatric disease. And I say that because what it is when we began to look at this, every year in the United States, we've got approximately 1.4 million children younger than 18 starting to smoke. And many of them are going to die prematurely because of that. Tobacco has all of the elements of a substance, of any substance that's addictive. It is difficult to stop. People have withdrawal when they stop. They are intolerant and they continue to utilize the substance despite the knowledge of personal harm. And with that, they are also likely to engage others in the behavior. And so I just want to be able to say, when you look at illegal drugs or addictive drugs, you've got all the elements, the same elements that you have with tobacco.
Beverly, I couldn't agree with you more. And I think you brought up the point, and I want to bring Dr. Hilliard into the conversation around this should be considered a pediatric disease. Dr. Hilliard, any reactions to that? And then also kind of elaborate from a pediatrician's perspective, are parents really aware of the health risk around tobacco use, and the young people that you serve, are they aware equally?
Yes, I agree with Beverly. Definitely, it's a pediatric issue. You should approach it, especially because of how young kids are starting when they start to smoke. I don't know if parents are fully aware of what exactly is going on now. I mean, we all know what tobacco was before and how it was marketed before, but the industry changed. It evolved, and if you're not keeping up with it, you may not know. Jewel. I remember my daughter telling me about a jewel. I'm like, what's a jewel? So there are different ways they are marketing it, flavored, e-cigarettes, vaping. These are things that we need to talk about with parents so they can know what's going on.
Yeah, I couldn't agree more. And then want to bring Bryce and Efi into the conversation. And Efi, when you think about some of the reasons that your peers kind of give you or you've heard around why they use tobacco, what are some of the reasons that you hear? Are you able to unmute? Well, Efi's kind of unmuting. We can just, Bryce, I want to ask the same question to you. When you think about kind of your peers and you've been an ambassador and kind of have really been instrumental in kind of helping disseminate some of these messages, what are you hearing?
Yeah, well, I've been really fortunate enough to be able to go out in the within my community, both as a high school student when I was in high school, and then, as an undergrad, I recently graduated. And so, and I know it's important to listen to the folks who are addicted to these substances to hear their struggles. And things that I've been hearing, are mainly, like the doctor mentioned, Juul is a huge problem, especially among high school students and especially among college students. We continue to see so many of them use it in, this new way because it's easier to hide. It looks cooler. It really almost looks like a flash drive. My mother is a teacher, and so when she looked at one of these things, she was like, I thought this was a flash drive. My students could have been using this and I wouldn't even have known. And so, it's easier to hide. And so I think that's why people are, flashing to Juul. And the other substance in my community that I've also noticed, especially, I've been noticing that, young adults have been really using this and college students, the hookah. And the crazy part is, and someone mentioned this earlier, the lack of education. Because so many folks who are using the hookah, they see it as, this is a part of what I do when I go out to the club. This is part of what I do when I go out and drink. So they see it as a social thing. But the problem is they don't even see it as a tobacco product. They're not even aware that this is a tobacco product and that it is deadly. And so I think, on both cases, we just have to continue to educate folks.
Bryce, I think you're spot on. And I want to transition back to Efi around the same topic. Efi, talk to me about hookah. I think Bryce brought up a very valuable point. People, especially younger people, and the people, even older folks, don't necessarily always are aware of some of the health effects of hookah and e-cigs. Talk to us about your experience and what you're hearing from your peers as well. I think you're still muted. Efi, can we unmute Efi? Can we unmute her? All right, so I think we're still you're still muted. So no worries, Efi. We're gonna get that tech fixed out for you. Not a problem whatsoever. Kind of want to transition back to Dr. Hilliard. When we think about some of the health effects of tobacco use, and what's going on from a tobacco kind of substance abuse standpoint, as Beverly so eloquently put it, what are some of the health consequences that you're seeing in the, separate apart from the cancers, what are you seeing, especially in children, from a tobacco use standpoint?
So good question, because everybody does have the focus of lung cancer for tobacco, but there are other effects. One of the main ones I think we focus on as pediatricians is going to be the effect on asthma. So not only if you are a smoker, is there a problem, but if you're exposed to secondhand smoke. So that can exacerbate the asthma, increase hospitalizations, increase your ER visits, and make your overall quality of life low. But then, of course, you have the effects on your heart and your blood vessel. And so you get cardiovascular disease, your kidney disease, your heart attacks. You also have the nicotine addiction, of course, that can be a possible gateway to other addictive behaviors. But I think another focus for the youth is going to be the effect on the still developing brain. Our brains don't fully develop until we're in our 20s. And so tobacco use is going to affect the parts of the brain that control impulse, attention, learning, your mood. And you see how this can affect a youth that's developing.
Dr. Hilliard, I think those are really incredibly valid points. And I think it's important for us to all learn of the complexity and the numerous nature of the health implications that can come as a result of tobacco use. And so, if you want to jump back to you for some of your insights around kind of what you're seeing, your peers, what you're experiencing, what you're hearing around different means to consume tobacco. I think Bryce really brought up some really good points around hookah. And so talk to us about what you're experiencing, what you're seeing.
Yeah, so a lot of our teams, I think, really start using vaping and like tobacco use, I think, not as with peer pressure, but peer influence. So they'll see like upperclassmen vaping, like, freshmen, when you first start high school, you're like new, you want to try everything. Then you'll see like seniors vaping in the bathrooms, the bathroom stalls, vaping in the backs of the classroom, they're really small to hide. And so definitely a lot of people start kids will start vaping because of the influence of others, and then also through like social media and stuff like that. Whenever I'm on social media, on TikTok, I always see people like having vapes in like their videos, and it's not even that they're not even like paid to promote it, but they still are. So teens are very like influenced through like everywhere you look, you'll see vaping. When I go on a walk, I will see like, you know, puff bars, they're disposable vapes. I'll just see those on the floor. And so like it's just like a huge like pandemic of every like they're being like it's always surrounding you. You can't like avoid it. And so like through hookah too, you know, if you see like a lot of teens with older siblings, because that's more of like an older crowd, they'll see like their adults. Like my friend, he doesn't smoke, but his older brother invited him to a party and they were using hookah there, and he's part of the tobacco club at my school, and his older brother was the one that was like using the hookah thing. So it's like surrounding you, and you can't really avoid as like a teen.
Mm-hmm. And so, Efi, I think that's an incredibly insightful point you made. So it's surrounding you. So it's obviously used in a very social context. From like a messaging standpoint, are you messaged, or is it just so around you all the time that you're over consumed by it? What's kind of like the messaging dynamic that you've experienced as a young kind of person? And then what is kind of the messaging that your peers see too, to kind of continue to, I guess, propel them to kind of use tobacco in different forms?
Well, I obviously have like bias because I'm obviously looking for it, but my teens will see it through, or my friends will see it through like, you know, advertisements, or like when I went to the airports, I was in Puerto Rico and I just saw like ads on the TV about like vaping, it's safe, and it's not safe. And so there's definitely advertising to like different communities, and then also through social media. You'll be like on social media, let's say like a live stream on Instagram, for example. Somebody's just talking to you. They're not saying go vape, but they'll be vaping, and it's somebody that you know or you like idolize maybe. So you'll be thinking, you like associate this like positive vaping with like a positive person that you like idolize and you enjoy, or like other famous people. So like indirect messaging towards my generation, I think, was what helped create like a positive connotation towards vaping.
Wow, no, that's very insightful, Efi. Thank you for sharing that. Beverly, I want to transition back to you and kind of talk about some of the mental health aspects of this whole systemic racism piece. And you do a lot of work in this space. Talk to us about what you've seen, some of the, I guess, the implications from the racial disparities, the inequities that we all face as communities of color. What are some of the consequences from a mental health standpoint that you've seen just on the ground and from an everyday perspective?
Well, what's really important is that we recognize that health and health disparities, that's referring to the differences, and everybody assumes that when we sort of throw around the word of the social determinants of health. And so for all of the listening audience, let me just simply quickly say what those are. The social determinants of how healthy you are overall is your economic stability, your neighborhood and physical environment, education, food, community and social contact, and the healthcare system. So we're focusing in on the healthcare system. When we think about health and health disparities, I just want you to realize that disparities amount to approximately $93 billion in excess medical care costs and about $42 billion in lost productivity. And I say that, and when I say the health disparities, when you think about mental health, I'm going to give you all a very quick example, something that personally happened with me. I was going to the dentist to get some work done. And the person who was cleaning my teeth actually made a statement. I had actually asked for a deep cleaning of my teeth. Now this was not the assistant, but the actual dentist, looked at my teeth and said, your teeth look really very clean. You must eat bones. And I said, excuse me? And he said, you black people, y'all like to chew on bones. Y'all eat bones. Now, here's the key to that. Because he thought that was true, this person was actually not going to give me the deep cleaning that I requested and had already paid for because of this myth. Now, I'm saying that if I had been a person who was not an advocate and very astute and quite frankly, a health advocate for a lot of people to get what they should be getting, this doctor would have given me substandard care based on some silly myth. And when I say that, and this is what I want people to understand, when we talk about health disparities, the ability to access care or the ability to have care to access is what drives many health disparities in our communities. And those health disparities actually really impact you. We have more obesity, more heart disease, more asthma, more homicide-related deaths. I mean, this is a whole nother instance of health disparities in terms that's highest among African-American men. Post-traumatic stress disorder, and I want to be able to say this. I was on another national town hall meeting with Nora Volkoff, who is actually the head of the National Institute of Drug Abuse. And one of the things we were talking about, racial discrimination on top of mental stigma. In our community, and this really comes to bear with this specific question, in our community, being Black in America is exhausting. It is exhausting. Every single day, you must get up and have to put on sometimes 2 and 3 faces to get through, to get things done, to keep, to get through life. Then when you add a mental health disorder, and this is very key because many of our community members, if they have a mental health disorder or they think something's wrong, they will not go to the mental health clinic. Let's be very clear. So our practice of accessing mental health is very low, but even more importantly, we don't trust the system. We don't trust the health system to look out for our interests because of long-standing experiences that African American people have had with the health system. So to combat that, what we have begun to do is we are using an evidence-based program called Bridges to Care. We have a cohort right now of 30 churches. And my foundation, I said that I'm going to fund African-American churches. And people said, just African-American? I proudly said, yes, I am funding African-American churches. And that's what I'm doing. That's how we're spending our money. And so in so doing, we are teaching the clergy and the congregation members what's called mental health first aid. And the reason for that is so that we can begin to detect more quickly when a member of the church actually has a mental health disorder and to understand how to appropriately refer them to a mental health clinic. On the other side, so along with that, we're literally beefing up and increasing the number of excuse me, mental health professionals to be able to respond to that. And then those congregations are looking at having a mental health ministry. That is so very key because our mental health drives the constant PTSD that we have just from being Black in America is absolutely drives so many of the other things that we do. Those stressors cause us to reach more for things, cigarettes, alcohol, sometimes illegal drugs, to be able to do that. So do understand there is a connection to the social determinants of health, and we have to be much more vigilant about accessing mental health care because of that.
Oh, well, Beverly, I couldn't agree with you more. And I see everyone on the panel shaking their head and kind of just really all the points that you just mentioned, Beverly, really resonate. And I want to leave the final commentary for Bryce. I saw you shaking your head quite a bit kind of during Beverly's remarks. I just want to hear from you, young brother. Where do you want to leave the group with?
Yeah, well, first of all, I just want to, thank the campaign for this experience and just say, how much of an amazing job that not just, these, 3 beautiful ladies, have shared with us, but also all the rest of, the former panel did an excellent and incredible job, and the only thing that I would say that I would feel that maybe hasn't been said that I think that is really important. I think that we as advocates, the advantage that we have, is really that we have a difference in the motivation from the tobacco industry. We know that the tobacco industry, they are led by money. They're led by greed. That's what they're led by. We as advocates and as community leaders, we lead with love. That's our motivation. And so because we love Black people, I know one thing about me is I love me some Black people, okay? Because we love people, that show. Okay, we've got to let the love and care that we have for Black people, be communicated in, we love you, we want you to live. Okay, and because we want you to live, we don't want you to get addicted to these dangerous substances. And if you do get addicted because of the many other, we start talking about the other social and other stressors in the community. If you do get addicted, again, because we love you, we're gonna do everything that we can, okay, to get you the resources that you need. Okay, and we're gonna do that by listening to you. That's another thing that the tobacco industry doesn't do. They don't listen. Okay, and because we are advocates, we know the importance of listening. So, that's all that I would say is that, there is a difference between, our motivations, and we have to let, our love of people, love of community, love specifically of Black people in this instance, lead us.
Well, Bryce, I couldn't have scripted that any better. So Bryce Moore, Beverly Watts Davis, Dr. Tricia Hilliard, and Ify Chidi, thank you so much for your time. We really appreciate it. Incredible conversation. And at this juncture, I would like to turn it over to our leader, Miss Portia Reddick White, for some final remarks. Thank you all again.
Wow, it's been an impressive night. Lots of wonderful information, lots of helpful information. Look, we've experienced a horrific year. It's a crazy world, right? Where we've seen and experienced inequality, systemic racism, police killings. More people are becoming aware of the health inequities. And on the eve of perhaps one of the most historic actions to start the process to prohibit menthol cigarettes, I want to thank the African American organizations that have been leading and helping, and those that are standing with us, like the African American Tobacco Control Leadership Council and the Association of Black Cardiologists, Black Women's Health Imperative, the Center for Black Health and Equity, the NAACP, the National Medical Association, the National Black Nurses Association, the National Caucus and Center of Black Aging, Save a Girl, Save a World, and the Links Incorporated. Look, the social determinants of health and the African American community we're experiencing that Ms. Watts Davis mentioned, they're all important. And the disparities that the African American community experiences, they're many. And we need them to be eliminated. We have to work together in every area that she shared to make that happen. Finally, if you need help quitting, call the quit line. 1-800-QUIT-NOW. 1-800-QUIT now. And if you want to join in this movement, email us at partnerships@tfk.org. That's partnerships@tfk.org. Join the young people, the youth ambassadors like Alyssa, Ify, and Bryce in this fight. Become a youth ambassador. TFK has been fighting for 25 years. Join us in this fight. Support your community. Share with your community. Don't die prematurely. And for heaven's sake, don't let those that you care about die prematurely. Yes, I've got to say that with this final quote of all the forms of inequality, injustice in health is the most shocking and the most inhuman. That's what Dr. Martin Luther King left for us. So join us in changing these injustices. Being Black in America is exhausting. Being different in America is exhausting. It's been a horrific year, but we can work together to make a difference. And the first step in this is to support the community, work together. Bryce actually stated it best. He said, we lead in love, and we do. The industry might have more dollars, and God knows they do, because they've been supporting all these arguments against banning or prohibiting menthol. But guess what? We've got more love. We've got more compassion. And you've got it too. So stay tuned, and thank you.